Hello, this is Dr. Mark L. Gordon of the Millennium Health Centers, Texas. Today's 1-minute lecture is called Testosterone, the Double-Edged Sword. Testosterone has been heralded as a universal cure-all for mood disorders, libido, and strength training. But the isolated use of testosterone in a TRT or HRT program has significant consequences. Unfortunately, many of my esteemed medical colleagues have ignored or forgotten the fundamental science of endocrinology that states that if you use testosterone or even estradiol, it will turn off luteinizing hormone in the process called negative feedback. Luteinizing hormone, or LH, is an extremely important hormone produced and released by the anterior pituitary that is the rate-limiting hormone for our brain's production of its neurosteroids and the body's production of its neuroactive steroids. Both types of steroids are manufactured from cholesterol, which is converted to pregnenolone, referred to as the mother of all hormones, but only in the presence of sufficient quantities of luteinizing hormone. Without LH converting cholesterol to pregnenolone, you also lose progesterone, pregnenolone, allopregnanolone, and cortisol on one limb of the steroid pathway, and DHEA, DHEAS, testosterone, DHT, and estradiol on the other limb. As a potential side effect from the lack of luteinizing hormone, you can have an elevation in blood cholesterol level. Both neurosteroids and neuroactive steroids are important for countering mood disorders such as depression and anxiety, while positively modulating irritability, agitation, insomnia, and libido problems. What commonly happens within 4 to 6 months of starting a testosterone or estrogen protocol is that the loss of these hormones causes an increase in depression, irritability, agitation, and possibly insomnia with altered libido. A male or female might present to the Millennium with a history of having been placed on TRT or HRT protocol. After nearly 6 months, they develop mood symptoms, which they share with their treating physician, commonly stating, in the beginning, I felt really good, but now I feel worse than when I started the program. The usual knee-jerk by this PCP is to increase the dose of hormones, which only delays and worsens the inevitability. The fix for this situation is to make sure you always take DHEA and pregnenolone 15 minutes to 30 minutes after dinner while on any hormone replacement therapy. Although you will still shut down luteinizing hormone production, you have replaced the two most important hormones that will feed into the steroid cascade and generate all your hormones. In the past 30 years that we have used this comprehensive approach, we have rarely had any issues with hormone-precipitated mood disorders or a sense that the program was not working. Thank you very much.